If you've been struggling to relieve sciatica leg pain, it's probably because you're doing one of these 5 exercises that I'm about to show you in this video wrong, or not doing them at all. You might be irritating the sciatic nerve instead of relieving it, maybe doing the exercise wrong, or maybe even getting the number of reps and the number of sets wrong. If you implement everything I'm about to show you in this video, you may start to relieve sciatica leg pain fast, allowing you to walk better, sit more comfortably, and get your life back to normal again. In this video, we're gonna cover them in great detail. In fact, 3 of these 5 exercises that I'm about to show you in this video just helped patient F find relief of a sciatic leg pain that was caused by a lumbar disc bulge. And the exact same thing may happen with you if you simply implement the sciatic relief exercises and stretches that I'm about to show you in this video. But I warn you, if you skip just one part of this video, you may miss out on that one exercise that may give you the relief you need. Hi, I'm Dr. Walter Slubro. I'm a chiropractor in Vaughan, Ontario, Canada. Before I demonstrate these stretches and exercises, I need you to smash that subscribe button if you want more content on how to bend, move, and lift easier without pain limitation using stretches, exercise, and corrective methods. I upload new videos every week. In addition to that, I created this free PDF ebook with 21 additional lower back exercises, stretches that can help to strengthen, stabilize, and even increase mobility of your lower back. You can get it in the link in the pinned comment below. There are 5 exercises to relieve sciatica leg pain fast that I'm going to show you in this video. We're going to start in the standing position and then move into the sitting position and then finish off in the supine lying on your back position. So let's do this. Follow me. The first one is a standing hamstring stretch. It's a great place to start because it's really easy in the standing position and can get the process started. How you do it is like this. You're going to stand and turn to your side, and we're going to stretch the hamstring muscles, which is important because the sciatic nerve travels from the lower back gluteal region along inside deep into the hamstring thigh areas into your leg and foot. So how you do it is like this. You stand and you're going to first tilt the pelvic forward. Tilt the pelvis forward. So round it forward, bring your foot up like this, okay, up, and leg out, and tilt the pelvis forward, and you're gonna lean forward like that. And I feel a nice stretch in my hamstring area. It feels really good. So here's the key, okay? The key is take the foot out, dorsiflex or point the toes towards your face, tilt the pelvis, okay? Look here, tilt the pelvis, and then lean forward, and you stretch the hamstring muscles. Very good, okay? So how do you do this? You hold it for 10 seconds. Keep that foot pointing up towards you. Hold it for 10 seconds. After 10 seconds, release a little bit and do it 3 times, okay? So I'm gonna reset all over again, right? So bring the foot out, dorsiflex or point the toes towards you. As you do that, tilt the pelvis forward. The key in this is tilting the pelvis forward. Tilt the pelvis forward and then lean forward and get a nice stretch. Now, the second time you do it, it should feel less uncomfortable, less tense, and should have more flexibility. Of course, if it brings on more leg pain, numbness, or tingling, then you ease up on it or you don't do it, okay? Then you do the 3rd rep. So 3 repetitions, 10-second hold, okay? So take it out, bring the toes up towards you, pelvic tilt, very important. Lean forward in that pelvic tilt position. I get a nice stretch in my hamstring muscles, feels very, very good, and it can help relieve the tension in the hamstring muscles, which affects the sacrum, piriformis muscles, and they irritate that sciatic nerve. We're now going to move on to the seated position, and we're going to do the seated nerve floss for the sciatic nerve. Seated sciatic nerve floss, also called seated sciatic nerve glide. And this will help move that sciatic nerve through the fascial tissues, those neural fascial tissues, and help relieve any adhesions that can irritate the sciatic nerve. So it's very, very useful. And what you do is you sit somewhere comfortable, make sure your legs as close to 90 degrees as possible. Take out the leg like this on the affected side. So let's say you have sciatica on the right side, and you want to bring that foot and point it towards you, okay? So level 1 of this, okay, if you can't do the advanced version, the basic version is just bring your toes towards you, just like this. I showed this to a patient earlier today, and he found it very useful. So bring it up like that, okay? And then you're gonna hold it for 10 seconds. Hold that for 10 seconds. And then you release, okay? The next level would be, if you can do this, is you bring your foot up. As you bring your foot up, dorsiflex point towards you, okay, and get that sciatic nerve tension and flossed even more, okay? It's gliding through those neurofascial tissues, okay? Hold it 10 seconds. And then the third level of progression would be for you to bend and bend your neck as well. So as you lift this up, bend and bring the foot towards you. And then release. Hold it for 10 seconds and repeat it 10 times. I'll do a few reps so you can see me and follow along. And you should find as you're getting up to your 5 to 10 reps of this, that it should be getting easier and easier for you and should feel some release of that leg pain from your sciatic nerve. Now the next exercise is also in a seated position. This is more of a lumbosacral, lumbopelvic mobilization exercise. I find that when we do pelvic tilts in a seated position, it really helps to loosen up that lower back region where the nerves that feed into the sciatic nerve come out of, and helps to really get that pelvis mobilized and relieve tension in and around those muscles that could be irritating the sciatic nerve. So it's a great exercise for sciatica. And how it's done is like this. You sit down in a seated position comfortably at the edge of the chair. Now I'm turning off to my side so you can see me on the video, because if I'm like this, you can't see me very well with the tilting. So you're gonna be square on with the chair. So I turn over so you can see me, and literally it's a pelvic tilt exercise. So if you see here, I'm gonna zoom in so you can see, we're going to tilt the pelvis forward, tilt the pelvis backwards, okay? You can follow along with your hands, okay? I like to give patients anywhere from 10 to 30 reps. You're not holding at the end of it. You're gonna slowly mobilize that lower lumbopelvic region, coordination, okay? So tilt, you're gonna arch your back over here, and then back, tilt, round the back, okay? As long as it doesn't aggravate your leg or back, you can continue this 10 to 20 reps. If you want, you can hold it there for a split second, one second, and then back and hold 1 second, okay? Very, very useful. Now, sometimes I'll get patients to go onto the angle, okay? So if they have left side sciatic pain, go away from it. If that irritates it, then go towards it. That could help, depending if it's triggered by a disc injury, okay, away to it. Sometimes I'll get them to go lateral. Pelvic tilting, lateral, okay? But either way, it's tilt forward, tilt back, tilt forward, tilt back. 10 to 20 reps rhythmically, okay? These exercises all can be done once or twice a day, the ones I'm showing you in this video, in the morning and in the evening. My back feels really good with this mobility exercise that I'm doing, the seated pelvic tilt. Now we're gonna move into the supine, lying on your back position. It can be done on the floor or on your bed comfortably. So the first one of these is lying on your back like this, and it's the supine piriformis stretch. Now the sciatic nerve travels underneath the piriformis, so if the piriformis is swollen or spasm or tight, it can affect the sciatic nerve and give sciatic leg pain. So let's say we're stretching out the left piriformis. I'm gonna bend the right knee, and then I turn my foot over and rest it on the knee. Now my piriformis is now tensioned, and I want to stretch that out by putting my hands through inside here and using my right thigh as a lever to stretch out the left side, which is done like this. And you're going to do 3 sets of these. Hold every stretch for 10 seconds. Here we go. Rest for a few seconds and repeat 2 more times. You'll find that it's really stretching out your piriformis area in the buttock region on the left side in this case, and also the thigh and gluteal muscles. I like to press the knee down to externally rotate the hip, activate the piriformis muscle even more in that position, and then stretch over here again. I also recommend that you switch into the opposite side, away from the effective side, just to even out the piriformis on both sides. Now, the last exercise, also in the supine position, we're gonna do a gluteal, back, knee to chest stretch. And if it's the left side, you're gonna pull this knee towards your chest, like just like that, and hold it for 10 seconds. I'm also gonna give you a variation of this, but for now, just pull straight back towards your body, towards your chest. Hold 10 seconds, repeat it 3 times. Release, and do it again 2 more times. On the 3rd rep, I'll show you the variation, but I want you to do 3 of these, pull back towards your body, okay? I'll show you a 3rd one actually, just like that. Good, and I always recommend doing the opposite side as well, the unaffected side. And then the variation is called an angled knee stretch. Go like this, pull towards the opposite shoulder on your angle like that, okay? You see I'm rolled over a bit. I see feel a nice stretch in the gluteal, piriformis region. The sciatic nerve emerges from there. Take off a lot of pressure from that sciatic nerve. Now, if the symptoms of the leg pain increase, then you need to ease off or not do the exercise. Switch legs, do 3 on this side, 10-second hold. And then when you finish, 3 here, 3 angle this way, 3 angle this way, then you can do doubles as well. Just like that. 10-second hold, and repeat that 3 times also. Now I want to hear from you. Which one of these exercises do you like the best, and which one are you going to try first? Is it going to be the seated sciatic nerve floss exercise or the supine piriformis stretch? Let me know in the comments below. Of course, ask your questions in the comments below. And I want you to continue learning on my channel, because if your sciatic leg pain is from an L405 disc bulge or an L5S1 disc bulge, I have the perfect video for you to watch next. Go watch this video right here. It's the most popular video on my channel that shows the anatomy of a disc bulge, why it causes so much pain, and I give you 4 additional exercises suitable for disc bulges and also sciatic leg pain relief. Go watch it right here, right now.